For more on that, let's turn to Congressman Joe Sestak of Pennsylvania. Congressman, good to have you on tonight. If you were a gambler in Vegas, you bet. If you were a gambler in Vegas, what are your odds that health care is going to get done by March 1st? What do you think?
Greater than 50%. And I say that because the facts are out there. 14,000 Americans lose their health care every day. How can we not take action? What's needed now, Ed, is simple leadership. Pure, compelling leadership. Let's take those things in the bill where there is agreement. Pre-existing conditions no longer denied. Small businesses, take the burden off of them and let them get into, well, in this case, probably just state markets. Maybe it's not a national market. Let's make sure that our small businesses get some subsidy that help them relieve the cost, and women don't have to pay 2 times as much. There are things in there that we can do deliberately in a way that explains to the public the goodness of this.
All right, you just said some real common sense, moving forward, progressive things that I think the majority of Americans would go along with. What we just saw in Massachusetts was basically a pushback against Washington. And the word now, after all of this, is that we're going to hit the pause button, and nobody knows what the next move is. Now, if that doesn't underscore Washington and how dysfunctional it is right now, maybe you should draw, Congressman, please, on your military experience. What would the military do right now? I mean, you can't hit the pause button when the people's business has to be done.
Washington is now doing something it has always been doing. It's taking a mirror and just looking at the populace rather than putting a mirror looking at themselves. This was not a vote against health care. It was a vote against an establishment that said it was going to go to Washington and change the way we govern. So Ben Nelson grabs his Snicker bar, says, you got my vote as long as I bring my bar home. Look, Massachusetts has the same health care plan, the Massachusetts health care plan, that's nearly 95% identical to the House bill, and polls show they like it. This was a vote against the lack of common sense leadership that doesn't just dictate, but actually explains what's going on. If we just take these pieces, putting them together in a deliberate way and say, you know, if around the 5 counties of Philadelphia, where 42% of the Pennsylvanians tend to live, if 66% of the uninsured are actually working, this bill's for you, the working family, and slowly but deliberately move forward. This is about leadership, accountable leadership.
And we're just not getting it right now, and the guy that's suffering from all of this is the guy who wants it more than anybody, and that's the President of the United States. So he's pivoting to jobs. He's in Ohio. He's talking about jobs. He's talking about the effectiveness of the stimulus package, and he's dealing with his own party who has a solid majority who says, you know what, we got to take a pause. How do you win in that environment?
Look, sometimes you got to put your face into the prevailing wind and just keep speaking and keep explaining. This can be done. We've had tougher challenges before on this. Look, I want the president's hand, however, stronger on the tiller this time, in the Senate particularly. I want the House of Representatives to be more transparent. We ourselves are pretty opaque, even when I'm trying to find something out.
Good to have you on,
This is about remembering, talking and explaining what needs to be done. Thanks, Ed.
Great to have you with us tonight. Thank you. Coming up, somebody call a doctor. The spin coming out of Sean